Hi everyone, Dinesh here, and today we're going to be talking about gut health and how it's really important for your overall health. So I was asked to do this for UBS Bank as part of their health awareness talks, and it's in collaboration with the UFit physiotherapy group. Unfortunately, at the time, I completely forgot to record it. So I'm doing a re-recording now and sharing it with you on my YouTube channel. So I hope you find this really interesting. In terms of what I'm going to be covering is what is a microbiome, why it's important to us, and also how you can help maintain it and keep it in a healthy state. Well, first of all, what is the microbiome? Now, the microbiome is a very broad term for bacteria that lives synergistically with us as human beings. And there's different microbiomes. There's the gut microbiome, which is obviously within the gut. There's the skin microbiome, there's the airways microbiome, and there's various microbiomes for different areas of the body. Now, in the gut, there's approximately 1 trillion bacteria that come from around 35,000 different types of families of bacteria. However, 90% of them come from two main types, firmicutes and bacterioids. The gut microbiome has many different functions, not just in terms of digestion. It can affect immune function, it can affect our general overall health, and also affects our longevity. There's also some evidence to suggest that the gut microbiome has an impact on other areas such as joint health. So what's special about the microbiome? Well, first of all, it's very individualized. My microbiome is different to your microbiome, and it's not just in terms of the families of bacteria that sit there, but also in terms of the quantities and the quality of the microbiome itself. However, there can be fluctuations in this microbiome as well over time, and there's certain things that can influence it, which we'll come on to in a second. But there are some generalizable rules that we can identify from studies of the microbiome and how we can try and optimize it moving forward. In terms of factors that can influence the microbiome, we have three main things that we can actually influence. First of all, it's our diet. Secondly, stress levels. And lastly, exercise. These are three factors that we have a direct impact on. Other things like the actual constituency of the microbiome and the makeup of it can be quite difficult to influence. When I was giving the talk at UBS, somebody asked a really pertinent question about microbiome transplants and transfer of one person's microbiome to the other. And while this might be available commercially, it's not always the most advisable thing to do because you don't know how somebody else's microbiome is going to impact on your own and whether your body will accommodate to it. So in terms of diet, things like fiber, fermented foods, and prebiotics can be really beneficial to the microbiome. Another area that I mentioned earlier is stress. And people who are under lots of chronic stress over a long period of time can have the microbiome negatively impacted by this. Part of the reason for that is you develop this chronic inflammatory state, and not only does it affect other areas of the body, such as the muscles and the joints, but also it affects the microbiome. And as a consequence, it may be that you have a negative impact on it and it is affected so that it has this cycle of impact on the rest of the body. And sometimes we have to try and break down the root cause of it, which will be the stress. And then lifestyle issues. So things like exercise, adequate sleep, limiting the alcohol intake that we have, all of these factors can influence the microbiome. The thing about the microbiome is that also not only does it affect the gut and other areas and systems in the body, but it can also affect the brain. There's lots of evidence to suggest that through neurotransmitters and neuromodulators, there's a direct and reversible impact of the gut on the brain and the brain on the gut. And a simple example is when you're feeling stressed, we often have a feeling of unsettledness and so on in the stomach. And in patients who have irritable bowel syndrome, we know that stress can be a significant factor when it comes to managing the IBS symptoms that they might be experiencing. So the gut affects the brain, and it does this through a variety of neurotransmitters, which can affect our mood, which can affect our thought processes and overall brain function as well. In turn, when we're experiencing stress and anxiety, this can directly impact gut motility. A change in gut motility can, as a consequence, affect the microbiome as well. And therefore, maintaining a healthy gut microbiome is really essential to maintaining mental and physical well-being. So earlier, I mentioned about diet and the impact that it has on the gut microbiome. Let's look at this in a little bit more detail now. Fiber is essential as a prebiotic for the gut microbiome. Not only does it help with gut mobility and emptying and evacuating the bowel, but also it allows the gut microbiome to feed on the complex starches, and then as a prebiotic, it helps it flourish. Another area is fermented food, so things like yogurt, sauerkraut, kimchi, things where the vegetables have been allowed to ferment for a period of time, and they themselves grow bacteria, which is beneficial to the gut microbiome. So these things help synergistically to help the gut microbiome stay healthy. And then finally, antioxidants, which are common in lots of fruits and vegetables. It's really important when you do eat these fruits and vegetables that you consume the skin as well, and not just the fruit juice that comes from it. When you have the skin and the antioxidants that's contained within, it helps reduce the inflammation effect on the bacteria, and as a consequence, it helps protect them and allows them to flourish. I mentioned about lifestyle and stress before. So trying to manage stress is really, really important on the gut motility. Now, I don't need to go into further detail, but as I mentioned before, when you have high levels of stress and anxiety, it can affect the gut and vice versa. And patients who have IBS will be understanding of this and see the importance of this relationship. Another area to be mindful of is exercise. And exercise is really, really crucial in terms of maintaining the gut microbiome. Not only does it help with gut motility, but because of the increase in blood flow and the movement of the gut, it helps with the gut microbiome and maintains its health. Lastly, maintaining good sleep habits and sleep hygiene is important. Between 7 to 9 hours of sleep is ideal, and if you can achieve this, it will certainly help with the gut microbiome. So let's look at exercise in a little bit more detail. In the past, studies which have considered strength training versus aerobic versus both of them combined have found that in subjects who take part in both strength and aerobic training have better gut health and gut microbiome status than those who just take part in aerobic training alone. In fact, high-level athletes and those of you who exercise on a regular basis at a high level have much better gut microbiome health than otherwise. And in addition to having better diversity and quality of the microbiome, they have more capacity for dealing with times of stress that might then impact on the gut microbiome. However, it's not all lost. And don't worry, there has been evidence to suggest that if you go from having a sedentary lifestyle to an active lifestyle, you can positively impact on your gut microbiome. So even if you're not currently very active, if you transition to that, you can improve your gut health overall. So as I said earlier, studies which have looked at subjects who take part in aerobic versus aerobic plus strength training found that people who combined aerobic and strength training had better gut health and better gut microbiome status than those who just did aerobic training. It also found that in subjects who did higher intensity exercises, there was better gut microbiome and gut health than those who took part in just low intensity exercises. And finally, in those who did exercise 2 to 3 times a week, there was mild improvements in gut microbiome and gut health. In those who exercised 4 to 5 times a week, there were more significant improvements. And those who did more than 5 times a week, there were the most improvements in terms of gut microbiome health and gut health overall. As with most things, there's a sweet spot. And the sweet spot will vary from individual to individual. But what studies have found is that too little will have some improvements compared to sedentary alone. Moderate improvements will probably have the most improvements that you will benefit from. And then Going from sedentary to high intensity may have a detrimental impact on your gut health and gut microbiome. So starting off slow, building up and maintaining at a good level, while then progressing to more higher intensity and more frequent exercise is a better approach, rather than going from doing nothing at all to really high intensity and lots of exercise altogether. In some ways, this is much the same as any form of exercise that you decide to do or sport that you decide to do. You wouldn't necessarily go from sitting on the couch to running a marathon. You would need a period of time of training and transition and adaptation to then achieve the goals that you want to do at the other end. So in the same way, your gut does need time to adapt and evolve to the exercise that you're asking it to deal with. Now, one of the markers that we can use for diversity of a microbiome is the Shannon index, and this can be applied to different areas. The Shannon index is essentially a marker or a measure of the diversity of the microbiome as well as the quantity of it. When you do exercise, it has been found that the Shannon index improves for individuals who start exercising or who exercise at a high level. And essentially what you will find is that the number of different types of organism improve as you exercise more, and also the quality of that bacteria will also improve. That said, the gut microbiome is vulnerable to gastrointestinal problems, things like malabsorption, irritable bowel syndrome, inflammatory bowel disease, dyspepsia. All of these things can impact on the health of the microbiome, but conversely, the gut microbiome can also impact on the nature of these conditions and the impact that it has on you as an individual. There's also evidence to suggest that the gut microbiome has a strong influence on other medical problems outside of the gut. This could be anything from hypercholesterolemia to diabetes, obesity, and it's even relevant in physiological states such as pregnancy. And it can be a key contributor in the fight against sarcopenia and frailty. So it's really important in other areas of the body, not just in terms of gut health. So let's digress a little bit and talk about iron and the relevance that iron has in terms of the gut and in terms of overall health. So in terms of iron metabolism, there's approximately 3 to 4 grams of iron totally within the body for an average 70 kilo man. About 0.8 to 1% is replaced throughout the day, and the normal diet has approximately 15 to 20 milligrams of iron in it, and we can absorb about 1 to 2 grams per day. Now, there are a number of things that can influence how much body iron that we have. First of all, inadequate intake could be a problem. So in people who don't have a diet which consists of either red meats or green leafy vegetables or any of the foodstuffs that contains iron, you might find that they have a deficiency. In addition, in subjects who have a increased loss, so if you have very heavy menses, for example, or if you have a chronic inflammation or chronic disease in the body, you might find that the iron levels are depleted. And then if you have issues with absorption from the gut, so maybe you have inflammatory bowel disease, Crohn's or ulcerative colitis or IBS, these things might be impactful on the absorption, the way the gut takes up the iron from the foodstuffs that you're eating. And as a consequence, it can lead to a deficiency. And then finally, if you have chronic inflammation in the body, and this is manifest through a chemical substance called hepcidin, which inhibits the absorption and uptake of iron. And as a consequence, if you have this chronic inflammation in the body, it can lead to iron deficiency anemia as well. The trouble with low iron is that you may not feel the impact of it immediately. It can affect your oxygen transport, your red cell production. It in itself can cause further inflammation and stress on the body, and then it can lead subsequently to tiredness and poor recovery. And as a consequence, overall, it can affect your performance. In terms of iron metabolism, there are some key elements that we need to consider. First of all is getting it assessed properly. So many of us go for health screenings and we may have a normal hemoglobin, but this doesn't always mean that our total blood and body iron is within normal limits. And so checking for this specifically is really, really important. And then when replacing it, it's important to choose foods that are rich in iron. And if you do decide to supplement, trying to take that supplement with orange juice or vitamin C to increase that absorption. Another important factor is to recheck levels after you have taken supplements or changed your diet. The reason for this is that although we might feel okay, we may not necessarily have the benefits or necessarily feel the benefits either. And then lastly, when you're dealing with this iron metabolism and issues around it, you need to also stem the losses. So whether it's from the heavy menstrual bleeding, whether it's from trauma, whether it's from chronic inflammation, you need to deal with these issues. Otherwise, you're going to always have this issue with low iron in the body. Now, lastly, I'm going to touch on sports screening because I think this is really important and relevant to gut health and iron. The way that sports screening differs is it's not just about an overall look at your health, but it's really having specific goals and objectives in mind and looking for areas where deficiencies may be having an impact on this, whether it's in what you're doing, your actual health and physiology, or whether there's something that's deficient in the body that might be impacting how you do things. Part of the sports screening is to look for intrinsic risk factors. So things like previous medical problems, previous injuries. Are there any other physical or physiological risk factors that you might have that may be contributing to ill health or poor performance? And these can stem from other areas, such as previous trauma, family history, medications that you might be taking, because all of these can have an impact on your performance overall. Another consideration is extrinsic risk factors. So things that might be outside your normal body physiology and in the environment around us, that might be impacting on your performance. So scheduling of training, time for recovery, the exercises that you might be doing, equipment that you might be using, and social aspects that might be necessary for support and to enable you to train. All of these things can have a direct impact on your sporting performance. And as a consequence, these are all things that we should be addressing and considering as part of the sports screening package. So here, I'm just sharing with you some of the things that I've come across when doing sports screening over the years. In terms of symptoms, you might have cardiovascular worrying things, such as lightheadedness, palpitations, chest pain. You may have runners who develop lots of gastrointestinal symptoms, or cyclists who develop nerve compression and tingling and numbness and weakness in different areas when they're cycling. On physical examination, there may be pallor, there may be high blood pressure, there may be murmurs from the heart, there may be irregularities in terms of alignment or posture that may all impact on the risk of injury as well as your performance. And then finally, in terms of investigations, there's lots of different things that I've come across over the years, but some common things are low iron, low vitamin D, there can be high lipids, and also many individuals are going around with asymptomatic bacteria. Now, you might say, hey, it's asymptomatic, it's not causing a problem. But the fact that they have bacteria in the urine may have an impact on overall health and performance. So let's bring it back to gut health and let's have a few take-home points. First of all, diet is really, really important, and choosing prebiotics, fermented foods, and those that have lots of antioxidants can help with gut microbiome and gut health. Exercise is really, really important, and also other lifestyle choices as well, such as adequate sleep and trying to limit alcohol intake. But my final word of advice is if you do have any concerns, or if you are going for screenings that just don't consider performance as the core element of it, please do get it checked and get things checked early. And if we can improve your gut microbiome and as a consequence your gut health and your overall health by doing simple modifications, all the better for it early than later on when chronic disease sets in. Thanks for watching. I hope you found the talk interesting, and if you did, please explore what else is there on the various channels and subscribe for further updates. You can also follow me on Twitter, Instagram, TikTok, and also if you want more info on sports injuries in general, please check out sportsmedinfo.sg.